there is a endocannabinoid system. And in this system, you have multiple receptors. And think of it like a lock and key mechanism. With CBD, some of them unlock certain processes. There are processes for pain, for inflammation. There are processes for hunger, for your appetite. There are processes for your mood, your anxiety, depression. And unfortunately, they have not been studied sufficiently to know exactly which one affects which. We have a general idea, and we do our best to formulate it so that we can modulate these receptors and give you the desired effect. There's CBD1 that affects more the brain and central nervous system, and there's CBD2 which affects the peripheral nervous system, which would be for joints, for nerves, and so on. Now that we have an understanding of the endocannabinoid system, I can tell you a little bit more about our product. CBD has been studied for cancer, for epilepsy, and has been found fantastic in numerous research journals to be effective in getting people off of their seizure medications, getting people off their anxiety medications, and eliminating the comorbidities from multiple drug interactions. There are people who need the CBD for the anti-inflammatory component, but they desire to not have that euphoric component, that psychoactive component of the THC. So in the state of Florida, there are 13 qualifying conditions for medical cannabis in order to get certified. There's cancer, ALS, there's chronic seizures, there's glaucoma, Crohn's disease, Parkinson's, multiple sclerosis, or chronic non-malignant pain. It is up to the doctor's discretion how to justify chronic non-malignant pain. For a patient who suffers from rheumatoid arthritis, or osteoarthritis, or peripheral neuropathies, or radiculopathies, or spinal degenerative disorder. So if you've been suffering for many years and you're on opioid medications and you're looking for a way out, this is a perfect avenue for you. Medical cannabis, in how it's used in its application, should be thought of just like taking any other medication. You could take it orally in capsule form. You can get it in a liquid for those who would like it in a liquid. Or you could take it through a vape pen, which is an oil that you would inhale. Or you could take it and apply it topically in a rub-on cream. Now, there are different advantages and disadvantages to each avenue. If you're going to take it orally in a capsule, you're going to take it normally, but it will have to pass through your entire GI system, and it may not take effect for a half an hour to an hour to an hour and a half. So there's a slower effect, but it has the longest effect of all the varieties. You absorb the most through the oral route. You could take it orally through a liquid, which is also good. It's a little bit faster. You put it under your tongue, and it takes effect in about 45 minutes. Not too bad. And then that lasts you about an hour to 4 hours. So it's not quite as long as the oral route, which can go 4 to 8 to 12 hours, depending on the person's metabolism. But it has a shorter time span to work through. Then there's vaping, which has an instantaneous effect. It has an instantaneous rapid onset, but it wears off the fastest. So depending on somebody's mode of use, you can get different effects. And it is absolutely feasible for somebody to combine two different modes. If somebody wants something to work fast, but also to last longer, theoretically, if someone's suffering from insomnia, they could vape, have something work quickly, and also take a pill so that could last them the entire night. One would have to be cognizant and speak with their doctor regarding the dosage and making sure there are no adverse effects and that they start on the correct amount of CBD and THC. In order to get certified for medical cannabis in Florida, one would have to be evaluated by a physician certified in medical cannabis and have a qualifying condition. One would have to have documentation of that qualifying condition with valid supporting evidence within the last 2 years, such as a letter from their previous physician or a document that states that they have a certain condition. Once we get you on the medical marijuana use registry, then we work the process to get you the medical cannabis card. And getting that card has become a more efficient process over the last several months. So once you're evaluated by the physician, you can expect to get a card from anywhere from 2 to 4 weeks. And really, it could be even sooner. And at that point, once you're approved, you can go to a dispensary. And a dispensary will have the various options for you to get the recommended amount of medical cannabis as written by your provider. I'm a big believer in CBD. I think CBD is the future. It can be used with anti-aging, as we said previously, for insomnia, for muscle spasm, for the anti-inflammatory conditions, and it's currently being studied for numerous other conditions. So, in the process of waiting for getting certified for medical cannabis, I would definitely recommend taking CBD. You could play with a dose and see how it affects you, and you don't have to worry about any of that psychoactive effect. So if you're looking for help immediately, I would definitely start with CBD today. CBD, among its many uses, also is very effective for pets. I've heard it and seen effects with tumors for pets, for insomnia, and for pain. I had my neighbor, I gave CBD, and it had tremendous effect. Going forward, medical cannabis is going to be a staple in Western medicine. It has been established through research, and America's laws are catching up. So if you have a qualifying condition, please do not feel threatened or fearful of the word cannabis. Ask your physician, ask if you can be helped by this. And if you have opioid dependence, or if you're taking multiple medications and if you don't like where you are, seek out the knowledge and really approach us. We'd be more than willing to help you. And definitely, there are safer alternatives. There are absolutely strategies we could put forth to cut you down on medication, to limit the need for certain medications, and well balanced in your life.